we know that osteoporosis is very common, especially in postmenopausal women, but also men have also a lot of osteoporosis and osteoporotic fractures. Actually, nobody can feel any symptoms of osteoporosis. Sometimes we diagnose osteoporosis lately after fracture, but we know because there are no symptoms of osteoporosis, everyone at risk of osteoporosis should have investigation for that possibility. And the nowadays guidelines recommend for every woman after age of 60 and every man after age of 65 to start survey for diagnosis of osteoporosis, and an earlier age and in population with high risk factors for osteoporosis. The leading factor is the age itself. So I said before that after age 60 women, 65 women should start survey for osteoporosis. Other risk factors include premature ovarian failure, taking medications that can cause osteoporosis, especially glucocorticosteroid. Other chronic diseases can cause also osteoporosis, like type 1 diabetes, celiac disease. Any disease that can cause malabsorption also can cause osteoporosis. These are the main things, and every chronic like rheumatoid arthritis, smoking, cigarettes, alcohol consumption more than 3 drinks a day also can cause osteoporosis and increase the risk of osteoporotic fractures. It's dangerous because osteoporosis, if untreated, can cause fractures. We know that 50% of postmenopausal women can develop fracture, less than that men. The main fractures are spinal fractures that can cause pain, can cause loss of heat, and can cause sometimes difficulties in breathing. And the main dangerous fracture is the hip fracture that can cause decreased quality of life, cause more infections, cause thrombosis in the deep vein, the leg, and sometimes pulmonary embolism that can also increase the risk of death and mortality. So it could be dangerous, and we can, by simple things that we can do, we can prevent or reduce the risk for fractures. The examination is DXA, BMD bone density, examination with a very low radiation, and there is no risk in this examination. Everyone in risk for osteoporosis should undergo this examination, and if it's normal, we can repeat it after 5 years. If the result is osteopenia, it's a range between normal and osteoporosis, should repeat it after 3 years. And if it's osteoporosis, should start treatment and repeat it after 1 to 2 years. And also, vitamin D level should be tested and corrected, especially in countries like Russia, where there is no enough exposure to the sun ultraviolet radiation, and because of that, there is no synthesis by the body of vitamin D, so they need vitamin D test and also vitamin D supplement to correct vitamin D and prevent osteoporosis. Of course, we know that physical activity strengthens the bones, especially strength exercise can strengthen the bones and reduce the risk for fractures. And again, should start vitamin D. The consumption of calcium should be at least 1,000 milligrams a day from dairy products, and sometimes also supplement, and also starting medications for osteoporosis. We have a lot of medications, effective medications that inhibit osteoclasts, the cells that resorb the bone. We have oral medications that we give once a week or once a month, but in some severe cases we give parenteral treatment by IV Aclasta that we give every year, and also it inhibits the osteoclast and also reduce cardiovascular events and reduce mortality. Other medication, subcutaneous medication, that is given every 6 months. And nowadays we have also anabolic medication that build bone. We had for about 15 years Forteo. It's injectable medication that we give every day for 2 years. But in the last years we have also other medication that could be the best medication to build bone. We give it injectable therapy every month for 1 year, and we have very good results with these medications. In general, we have very effective medications that reduce effectively the possibility of fractures due to osteoporosis.